Okay, then we have here the reporting of the result for the prothrombin time. So your prothrombin time result could be presented in the following. Number one, clotting time. The clotting time activity is being presented in seconds. It's followed here by percent activity. Percent activity is just the relationship between your prothrombin time concentration, prothrombin concentration, and your percent activity, and your clotting activity. Usually, yung cut-off natin is 70%. Pag medyo mababa, so 70%, then ang percent activity ng prothrombin patient natin is less than 70%, the patient would have a bleeding tendency. So like for example, pag nirequest ng patient natin ng prothrombin time, then mag-undergo ng surgical operation ng patient natin. If the prothrombin time niya is less than 70%, then dapat hindi siya mag-undergo ng surgical operation. Because that would result here to the massive bleeding of the patient during the surgery. Another way of reporting that your prothrombin time is your INR, or in terms of the International Normalized Ratio. Raised to your ISI, International Sensitivity Index, na makikita natin sa product insert ng reagent natin. INR is just the ratio ng patient's plasma prothrombin time result niya over the normal plasma na prothrombin, or normal plasma na prothrombin time. Okay, so we are reporting that one in the INR in order for us then to standardize the result of your test regardless of the source of your prothrombin reagent. So kahit saan ka pupunta na lugar, basta naka-raise sa INR, it would have the same interpretation because of that. Okay, we have here the normal values for our INR, so 0.9 to 1.3. That is usually for healthy patient natin. Okay, 2 to 3 na result is related to the patient on the anticoagulant therapy in the form of your warfarin. So, increase naman siya, for example, more than 1, pero hanggang 1.3 ang ating normal. But if the patient would have already here mga ganito 1, or more than 1.3, the patient would have, meaning to say prolong, ang kanyang prothrombin activity or prothrombin time, that would signify the patient would have a bleeding tendency. Okay, if the results niya ganun, more than 5, 5.5, sobrang taas niyan, okay, that's already unacceptable, then we are considering the patient to have a bleeding already. But if the result is sobrang baba, nag-clot agad, so, mean to say the patient would have here the thrombus formation or the clot formation tendency. Okay, we have here the diagnostic significance of our prothrombin time. Again, we use the prothrombin time to screen for the problem related to your deficiency of your extrinsic pathway and our common pathway. So this also used here to screen for the problem related to your factor 7 deficiency. Factor 7 belongs to your extrinsic pathway, diba? So that might be related to the deficiency of your factor 7, like in the case of your vitamin K dependent coagulation factor deficiency. Remember that our vitamin K dependent coagulation factors includes your factor 2, 7, 9, 10, protein S, protein C, protein Z. So may factor 7 tayo doon. And if the patient would have a vitamin K dependent deficiency, so it will prolong your prothrombin time because meron siyang factor 7. As what we have discussed, the factor 7 among our vitamin K dependent coagulation factors is the first na mag-decrease if the patient would have a vitamin K deficient. Because again, our factor 7 would have the shortest half-life of all your coagulation factors belonging to your vitamin K dependent coagulation factors. Liver disease, on the other hand, ano ulit ang liver disease natin? Liver disease combination ng vitamin K dependent coagulation factor deficiency and factor 5 deficiency. So pag ang patient natin may factor 5 deficiency na kasama na, so become a liver disease. Pero pag wala kang factor 5, so that's your vitamin K deficiency. So factor 5 na deficiency will differentiate if that one is vitamin K dependent lang ba or is that a liver disease. Kasi pag may liver disease, to dapat pati ang factor 5 natin ay mababa ang ating factor 5 deficiency that's related to your liver disease. DIC would also have prolonged na result. Anyway, sa DIC naman lahat ng ating test results will be abnormal, not only with your prothrombin time. Okay, then we have here some considerations when we are doing your prothrombin time. The first one, we have here the blood volume. So, dapat, again, we are using the blue or citrate na anticoagulant for our coagulation studies. So, make sure that you try to fill your tube to the desired na mark niya. So, for example, kung ito siya, kung dito ang mark niya, so dapat doon ka mag-fill ng blood. Hindi pwede na below that one. In the case of your short draw, konti yung blood, for example, ito ang required dapat na blood natin, tapos dito ka lang nag-fill, meaning to say the short draw, and what you have here, much of your anticoagulant, may excess ka na anticoagulant. Ano mangyayari pag may excess ka na anticoagulant? Then pag nag-perform tayo ng Thrombin Time, pag nag-add ng calcium chloride na reagent ng ating Thrombin Time, yung calcium chloride, ang excess mo ng anticoagulant, mag-react sa calcium chloride natin. Dapat kasi ang calcium chloride natin, mag-react siya dito sa plasma natin with your coagulation factors. However, ang plasma mo, ang sample ng patient natin, may excess ka na anticoagulant, your calcium chloride tend to react, okay, first with your excess anticoagulant more than your coagulation factors. So, unahin muna nito mag-react sa excess anticoagulant bago ng ating coagulation factors na dapat yung tinitest natin. And therefore, magiging prolong ang ating clotting time kasi hindi siya agad-agad nagkaklat. Hindi siya agad-agad nagkaklat because your calcium chloride, inuna niya pa mag-react sa excess anticoagulant natin kasi short draw ang sample natin. And therefore, before siya mag-react sa coagulation factors natin, which is supposed to be ang pinaka-target ng reagent natin. And therefore, it will take the time that one to have here longer duration before siya mag-activate ng coagulation factors. Expect to have eventually a prolonged test result. Another one, when the hematocrit of the patient more than 55%, sobrang lapot ng blood ni patient, so you need to adjust for the volume of the citrate. Okay, so volume of the citrate, how are we going? We have the formula for that. So that's 1.85 times 10 to the negative 3 times 100 minus, okay, hematocrit the patient, it's a percent ito. Basta dapat more than 55%, so like 60% minus 60, 100 minus 60. Then the volume ng blood. Ilan bang blood ilalagay mo sa tube natin? And for example, if you are requiring 5 ml, so yan ang total volume natin dito. Whatever your result here, that become the volume of your citrate. Usually ulit, pag nasa blue top tayo, 1:9 ang ating anticoagulant blood ratio. Pero, pag sobrang lapot ng dugo ni patient, hindi na siya magiging 1:9 in order for you to prevent the clotting process. So, adjustment, how much ang volume ng citrate na gagamitin mo instead na 1 part versus 9 part. So, okay, you try to compute using the formula that become here the volume of the citrate. Okay, then we have here another problem that we could encounter here when we are doing your coagulation studies, not only for the PT, Thrombin time, as well as with our activated partial thromboplastin time. So then we have your clotted specimen. Clotted specimen should eventually not be processed because again, this is a clot-based na test. So pag clotted na ang blood natin na beforehand, so okay, so ang result natin ay agad-agad magkakaroon ng clotting time, so that will be increased. Or that will be short ang ating magiging clotting time result. Hemolyzed specimen should also have here shortened ang ating clotting time result, mean to say magka-clot agad siya because in the hemolyzed, especially like if the patient would have been undergoing traumatic puncture, going through and through, it will activate immediately your factor 3, your tissue factor because of that, and therefore that results here to your clotting time results agad-agad. Ecteric lipemic specimen, so that could be measured here not with our special photometer, but you can use mechanical coagulometer instead of the optical one because your optical na coagulometer will tend to be affected by our ecteric lipemic specimen. So with that, you see your mechanical coagulometer in order for that not to be affected by ecteric or dark yellow, lipemic, so sobrang cloudy ng sample natin. Then we have here the patients on the heparin therapy. So remember that your heparin is anticoagulant, so it will have here a false result or a false increase without actually determining the exact clotting time result ng patient natin. So if the patient is on the heparin therapy, okay, then you need to use the polybren in order for you then to neutralize the activity of the heparin in order for that not to interfere with the result. The patients with lupus anticoagulant, okay, so measure that one using your chromogenic factor 10 assay. The next test, we have your Aptptp or activated partial thromboplastin time. So this is the test for evaluation related to your intrinsic pathway, your 12, 11, 10, 12, 11, 9, 8, plus your common pathway, 10, 5, 2, 1. Okay, and this one also used to monitor patients on heparin therapy. Ang Thrombin time natin, ginagamit siya to monitor patient on Coumadin or warfarin therapy, which is your oral na vitamin K anticoagulant. But when the patient is on the heparin therapy, to monitor the clotting time of the patient, then you try to measure that one using your Aptp. Okay, then we have here the principle of your Aptp. So, our sample is still your PPP, platelet poor plasma, plus your phospholipid, calcium chloride reagent. Your phospholipid here is a partial thromboplastin. Another one, kailangan natin dito ng activator since your intrinsic pathway starts with the factor 12, which is your contact factor. So, para mag-activate siya that will eventually proceed with the clotting process, you need to activate that one with your activators. Part of the component ng reagent ng Aptp natin will be your activators. This includes your silica gel, your kaolin, your zeolite, ellagic acid, and your non-siliconized glass. Again, out of that one, try to activate your factor 12 in order for you to proceed with activation factor 11, activating your factor 9, factor 8, and proceeding with a common pathway. And that result here to the clot formation. That's what you are measuring, monitoring for that. Okay, procedure. So, same lang din ng ating Thrombin time. So, again, you start the timer as soon as you add your calcium chloride. Pero ang result ng ating Aptp is being presented only in terms of the clotting time in seconds. Wala itong percent activity na result just like in your Thrombin time, wala din itong INR na result. So, again, we are using the Aptp as a test result here primarily for evaluation of problem related to your intrinsic pathway, 12, 11, 9, 8, plus your common pathway, 10, 5, 2, 1. Patients with a DIC will also have a prolonged Aptp result. And also this one is used for evaluation of patients on or to monitor the patients on the heparin therapy. Hindi ginagamit ang Aptp natin for monitoring the patients on the warfarin or Coumadin therapy because the patient on the warfarin and the Coumadin therapy, we are using the Thrombin time in order for us then to monitor the patient. Okay, the next test we have here your Thrombin time. So, other name for that is your Russell Viper-Venom time. The source of the reagent here coming from the poisonous snakes na snake na Daboya roselii. So, this is the test primarily for evaluation related to problem with a common pathway. That's your 10-5-2-1. So, if you have problem with 10-5-2-1, it would have prolonged the result with your Thrombin time. Okay, so, principle for that, we have here your PPP as your sample platelet poor plasma pa din with your Thrombin reagent plus your platelet calcium chloride. This one is also used here to evaluate for the presence of your lupus anticoagulant. But Thrombin time is basically for evaluation of problem related to your common pathway. Okay, next we have your Thrombin time. Thrombin time here, so thrombin, you try to convert your fibrinogen to your fibrin clot. So all problem related to your fibrinogen will have here prolonged with your Thrombin time. So pag wala kang fibrinogen, wala kang ma-convert into your fibrin clot, so walang clot formation, that will be evaluated here as a prolonged na Thrombin time result. So Thrombin time here is basically for evaluation related to your problem with your fibrinogen. Okay, so that includes your afibrinohemia, wala kang fibrinogen, hypo, or dysfibrinohemia na mababa ang ating fibrinogen concentration. Another one, the presence of your fibrin degradation products, fibrin split products. Another one is the presence of your heparin. If the patient is on heparin therapy, it will affect the results of your thrombin time, it will have here the prolonged na test results. Again, we have your platelet poor plasma pa din ang sample natin, plus your thrombin calcium chloride reagent, and try to observe for the clot formation with your as your end result for that. So, magiging prolong ang ating thrombin time result if you have problem with your fibrinogen. It may be in the form of your afibrinogenemia. Ito pinaka-worst. So, kasi wala ka tagang fibrinogen. Another one, presence of fibrinogylation products, presence of the heparin, and the presence of your dabigatran. Dabigatran is your thrombin inhibitor. Okay, so tri-inhibit is a drug that try to inhibit the activity of our thrombin. And therefore, once the patient is on dabigatran na drug therapy, then expect that it would have a prolonged na thrombin time result. So, the thrombin time will just para siyang, qualitative. So, pag prolong siya, we are suspecting na may problem sa fibrinogen concentration ng ating patient. But, we don't know kung gaano ka-konti ang ating fibrinogen concentration with that. You can perform here your fibrinogen assay. This one will detect specifically the exact concentration of the fibrinogen of the patients. So this is your quantitative fibrinogen concentration determination. It makes use of the reagent of bovine thrombin plus your platelet poor plasma. But with this one, your platelet poor plasma should be diluted first with your orange buffer before you can use that one as your sample. Your reagent is bovine thrombin at 50 NIH unit per ml ang kanyang concentration. Okay, so result of this one is inversely proportional to your fibrinogen concentration. What do you mean by inversely proportional? So, pag mababa ang fibrinogen concentration natin, so expect to have a prolonged result. So, pag madami kang fibrin, so pag normal, so you will have normal results. Okay, so we have here the clinical significance of your fibrinogen assay. So, again, the normal values of your fibrinogen is 220 to 498 mg per dl. Decreased level less than 220 mg per dl is associated with our DIC, whereas more than 498 mg per dl is related to your severe infections, inflammation, related to your liver disease, and even to our pregnancy. For the next test, we have your reptilase time. Reptilase time, so we are using here another reagent extracted from a very poisonous snake, the Botrops atrox snake. Okay, so this one with parallel the results of your thrombin assay or your thrombin time, only that this one is related to it can convert actually to your fibrinogen, to your fibrin clot, only that it would differ with the action of your thrombin. Because our thrombin able to hydrolyze our fibrinogen to become fibrin clot by hydrolyzing the fibrinopeptide A and the fibrinopeptide B. But in the case of your reptilase, it can convert your fibrinogen to your fibrin clot only by hydrolyzing the fibrinopeptide A lang sa kanya. But then again, problem related to your fibrinogen will also be increasing the result of your reptilase time because again, of their action na kinoconvert niya ang ating fibrinogen to your fibrin clot. This is also affected by the presence of your fibrin degradation products, fibrin split products, but this one is not affected by heparin. So even if the patient is on heparin therapy, this one will not have a prolonged result. That would differ here with the result of your thrombin time, which is affected by your heparin. So we have here the principle of that. So we have platelet poor plasma plus your atroxine reagent. Okay, so wala siyang calcium chloride. Okay, another test, we have your Duckworth's test or 5 molar urea solubility test. We can also use here your 2% acetic acid or 1% monochloro acetic acid. So this one will identify the factor 13 deficiency because that one produces a soluble clot. So pag walang factor 13 ng patient natin, ang kanyang clot is soluble, which is able to dissolve in your 5 molar urea solubility test. Pero pag ang mga other clot natin, other factor problem, or if the patient will have normal, wala siyang factor 13 deficiency, it try to produce here clot which is insoluble and that one is not able to dissolve with your urea. So again, your factor 13 will have here all the abnormal result except your Dacker's test. So as a summary, we have here different tests. So nasa PowerPoint natin siya, kindly refer to that one. Okay, so we divide here the different disorders as number 1, vascular disorder related to problem with your blood vessels. We have also here your factor 1 deficiency, factor 2, factor 5 is your parahemophilia, factor 7, factor 8 deficiency, von Willebrand factor deficiency, factor 10, 11, and 12, factor 13 deficiency, and our DIC. So bleeding time is only prolonged with your vascular disorder because remember that the bleeding time is the screening test for our primary hemostasis. Since your blood vessels belong to your primary hemostasis, so that one would have a prolonged test result. All the other tests here, which are your for coagulation studies, your vascular disorder will have a normal result. Only that would have a prolonged result with your bleeding time because again, that one is for the primary hemostasis. Okay, the clotting time, lahat ito for coagulation factor deficiency except your factor 13 because remember that your factor 13 would have a normal result in all your tests except our Dacker's test. Okay, prothrombin time, again, for problem related to your factor, your extrinsic pathway. Okay, that's your factor 37 plus your common pathway, 10, 5, 2, 1. AptT is for the screening test for your intrinsic pathway. It's factor 12, 11, 10, factor 12, 11, 9, 8, plus your common pathway, 10, 5, 2, 1. It will have your prolonged APTT results. Okay, Stephen time is for the common pathway. So, lahat ng common pathway deficiency natin, like your factor 10, 5, 2, 1, it will have prolonged na Stephen time result. Thrombin time is for the factor 1 because this one is for the screening for your fibrinogen concentration. Okay, Dacker's test is only for your factor 13. Okay, notice here ang factor 13 natin, deficiency normal, ang lahat ng test result niya except your Dacker's test. DIC naman, lahat yan ay abnormal. Okay, including your bleeding time, this will also have abnormal result. Abnormal lahat result niya, even or including your Dacker's test. So that will identify our DIC for that.